Yeah, చేసేద్దాం. So, good evening, all of you. I'm Dr. Chalapathi, Gastroenterologist. I work at Kim's Icon Hospital, Visakhapatnam. So, I hope all of you are doing well. Um I think we are coming. The second wave of pandemic is coming down, but we have to take care of all precautions so that we prevent the third wave of pandemic. And please get vaccinated. Maintain social distancing. Wear your own masks and keep physical distance of at least 2 meters. So, because of this pandemic, we are doing a series of live lectures to reach our patients and public through this Facebook platform. And in this regard, we have come out today also. So today we are going to discuss something about a serious issue of liver problem, which is called liver cirrhosis. So liver cirrhosis means it is a medical term. So liver gets damaged permanently and it cannot be reversed back to normal. So it is something like an end stage problem. Uh, and it can be of two types. One is not so end stage, second is end stage. So you can call it as compensated cirrhosis, second is decompensated cirrhosis. So why this liver cirrhosis happens? Because of 4 or 5 common problems. Commonly because of alcohol intake. So those who take alcohol continuously for 5 years, 10 years, 20 years, so they can have this liver get damaged repeatedly, and it can go into an end stage, and from where it cannot come back. The second one is about alcohol. After alcohol, it is hepatitis B and hepatitis C viruses. Hepatitis virus is a kind of virus infection of which two types of viruses, that is hepatitis B and hepatitis C, can actually lead to repeated inflammation and damage in the liver, and after certain stage it can cause irreversible damage, and it is called again cirrhosis. So even viral hepatitis, especially hepatitis B and C, can cause it. The third major cause is fatty liver. Uh, Very frequently on ultrasound scan, we come across these reports of fatty liver, but rarely they can progress and they can damage, especially in patients who have diabetes, sugar problem, and also overweight, that is obesity. So in these two people, especially those who have diabetes and those who have obesity, fatty liver can progress and go on. The fat itself in the liver can cause repeated inflammation, damage, and then can lead to cirrhosis. So, across the globe, throughout all countries, these three are the major causes. One is alcohol, second is hepatitis B and C virus, the third is fatty liver. Uh, so then what happens? So we have many years and decades, almost 1-2 decades of gap before this is identified. Like for example, if somebody gets hepatitis B, C, there is a risk of cirrhosis after almost 10 to 20 years. So similarly, alcohol, similarly fatty liver. So we have a lot of time to identify these patients and treat them so that they don't go into cirrhosis. So that I will be covering in some other lecture, how to do that. So as of now today, we'll be covering about cirrhosis. So cirrhosis is a irreversible stage. Uh, Most of the times it progresses. It is difficult to control once it starts, and once it gets complicated, it is even more difficult for liver specialists and for us to treat them. And it can be complicated by many things. It is because liver is one of the very important organ in the body. When it gets damaged, all its functions are lost. So patients can have jaundice. The jaundice, like eyes will turn yellow, the skin will turn yellow, the urine will turn yellow. They can have jaundice. And some people complain of itching because of this jaundice. They keep on scratching their skin. The next complication that can happen is the protein levels in the body can come down because liver generates protein, liver forms protein, liver produces protein. So once this protein is reduced in the body, uh, there will be a lot of problems because of that. Majorly, water can get accumulated into the stomach and into the legs. So there can be the stomach grows very big. It gets bloated, it gets distended more and more. So sometimes it can be very much tense, like a football or a balloon, like. So it will be very big. So when we put a needle, we can take water and send it for tests. And along with that, the water can get accumulated in the legs and they cannot fit their shoes, they cannot fit their chappals, slippers, etc. They get very tight. Commonly, the water gets accumulated more in the evening time, and they come down normal in the morning time after they sleep. So this is because the protein in the body uh, becomes deficient because of the liver cirrhosis. Another problem because of protein deficiency is bleeding problems or clotting problems. The blood is normally in a fluid state, so it doesn't bleed and it doesn't clot. But in liver cirrhosis, because of problem in bleeding and clotting, sometimes it can be bleeding too much, sometimes it can be clotting too much. So, uh, like for example, bleeding, it can be so simple. Like if somebody brushes their teeth, then there can be bleeding from the gums. There can be bleeding from their mouth. There can be bleeding in their motion. There can be bleeding under the skin, like small spots can happen, like that, and big patches also can happen. So this is because the protein inside the body is deficient and it may not generate the adequate protein to clot the blood and to control the bleeding. So bleeding is one major problem. The another major problem is actually the blood vessels get very much congested within the intestines and the food pipe and in the stomach. This is because the liver gets damaged repeatedly. The pressures inside the veins in the liver is it increases and the veins get engorged, it gets congested, and at some time the pressures increase so much that it can get explode inside, and patient can come in an emergency with bleeding, and patient can vomit out blood, can be very serious. They can go into shock also because blood is lost so very suddenly, and we have to admit them, and it's an emergency. So bleeding problem is a very dangerous problem because of liver cirrhosis, and it has to be treated and addressed very, very efficiently. And patients have to be in ICU, critical care setup. Endoscopy has to be done, blood has to be given, all these things. The another major problem is because of the liver cirrhosis, it can get affected and can cause damage in the brain. It is called encephalopathy. Like the brain can get depressed. Patients can be very agitated. Also, sometimes they talk very irrelevant, and patients can go into deep coma. They will not be able to recognize where they are, what is their name, they can't recognize their relatives. And whenever you try to wake them up, it is very difficult. They will be continuously sleeping, especially in the morning time, and they will be awake in the evening time and at the night time. So that creates a lot of problem to the family members also at home. And some patients they can have irrelevant talk, they don't know what they're talking. Sometimes this brain damage can be very, very subtle, very, very minor. Like suddenly they will forget how to reach their home. Suddenly they will forget how much change they have to give it to the shopkeeper. Sometimes they forget the calculations: 2 plus 2, 4 plus 4, 6 plus 6. So they have memory loss. Sometimes they, when they are driving, they can go into accidents also. So like small things can still happen in patients with liver cirrhosis. So we need to identify this very early, report it to the doctor, so that a future major brain problem because of liver cirrhosis can be prevented. Very important and very uh, dangerous complication, because patients can land up in fits problem, weakness, they can have coma, they may not be able to breathe themselves because of deep coma. All these complaints can happen because the brain can get damaged because of this. The other major problem is infections in the liver, infections in the body, infections in other parts of the body, or infection anywhere in the body. This can happen in patients with liver cirrhosis if it is not treated well, and if it is not identified early and treated well, then patients can have serious infections. Most commonly, the infections can be in the lungs, can be in the urine and kidneys, can be in the water in the stomach, and in the legs also. So some these are the very common sites for infection to happen in liver cirrhosis. So why these infections happen? Again, because of protein deficiency in the body. So when protein deficiency happens, the immunity also comes down. So because for immunity, protein is very important. So the immunity is down, and so these patients catch up infections very, very fast and very, very quickly, and it can be very, very damaging. So it can damage to the extent that the liver can suffer a lot because of these infections, and overall we may lose patients also sometimes. Patient can go into liver failure, patient go into other organ failures, and patient can die also. So identifying infections in liver cirrhosis is very, very important. Treat them aggressively, and then we have to save the patient. The another major problem is uh, patients can develop a secondary problem because of liver disease, that the effect of liver cirrhosis can extend and can cause kidney failure. So we know liver failure is very damaging, cirrhosis is very damaging, but additionally, kidney can also get damaged because of liver problem. The creatinine will go up, the sodium levels will come down, water levels in the body will go up, and patients gradually they reduce the urine output, the urine doesn't come out, and it will be a problem. So patients who have liver cirrhosis, we need to identify the kidney failure very, very early. That's why we actually prescribe these patients regular blood tests, including kidney function tests, so that to see if there is any kind of kidney failure which can be detected in the lab itself first, because the lab values go abnormal very fast before the patient and the family notices it. So it is very important that we regularly monitor the kidney parameters also, and sodium levels also, so that it doesn't spill over. Apart from that, there are many other problems that patients with liver cirrhosis can happen. This is like patient loses protein from the body. They will lose their muscle mass. The arms will become very, very thin. The face will become very thin. They will lose the muscle. They become very, very thin. But at the same time, because of the water accumulation, the stomach will be full, the legs will be full with water. So this is because of again liver problem, liver cirrhosis. The body will be sucked out because of the disease. So we need to address the nutrition very, very importantly. The major superstition, or what we have taboo or a belief, or in fact a misbelief, a wrong belief, is about the diet in liver cirrhosis. Please consult your liver specialist and see what diet has to be taken. because too much diet restriction, protein restriction in liver problem is not necessary. So you have to be very, very careful about that. So what you do with this? So the only thing that how you get rid of this liver cirrhosis is treat the underlying problem. Like if patient is alcoholic, you have liver cirrhosis, ask them to stop strictly, ask the family to support the patient, don't discard or abandon the patient. You have to support the patient very, very carefully and consult the psychiatrist. And we need to promote de-addiction and encourage the patient to stop alcohol, because when alcohol is stopped, there is high likelihood that this liver cirrhosis will stop at that level and will become stable at least. Like it will not progress. That is number one thing. So similarly, if patient is having hepatitis B and hepatitis C virus infections, we'll treat them. Hepatitis B, there are very effective medicines. We need to give them for a very long time. Hepatitis C, we have very effective medicines. We give it usually for 3 to 6 months uh, to get rid of this hepatitis C. The success is very, very good. And once this the cause of this liver cirrhosis is eliminated, especially this hepatitis B and hepatitis C, then patients do well. The progression is stopped there, and sometimes it can come back also. So, identification of the cause is very, very important. Third one is about fatty liver. As I told, obesity and diabetes. If we manage obesity and diet and diabetes by giving insulin or tablets to control the sugar, and also good exercise program, good weight loss program, if the patient reduces weight, then it will be very good. The likelihood of progression and liver cirrhosis also comes down. So it is very important. The next comes the management of the complications. Like if there is a water in the body, in the stomach, in the legs, then we give tablets to remove water from the body. Sometimes we repeatedly remove the water from the stomach by putting the needle. If there is a bleed, we give platelet transfusions, we give plasma, we give blood so that the blood gets clotted. Uh, if there is any kind of bleeding from the congested blood vessels, we do endoscopy and we do control the bleed by using endoscopic methods. If there is a brain problem, we consult the neurologist, we treat it by giving effective medicines, syrups, etc. If there is kidney problem, again there are we inject protein injections. We consult nephrologist. We'll give medicines to reduce the pressures within the liver so that the kidney function improves, like that. If there is any infection, first to prevent it, we give certain vaccines against pneumococcal infections, flu infections, etc., hepatitis A virus infection, etc., so that there will not be any infections. But if at all, unfortunately, if infections start, then patient has to be admitted and we give IV injections, antibiotics, etc. So that is related to complications. But ultimately, as I told uh, in the initial part, first part of my lecture, liver cirrhosis is largely irreversible. Like it progresses. There is no effective medicine to actually bring it back. And actually, we know that liver regenerates. Liver has a lot of regenerating capacity. But liver cirrhosis happens when all this regeneration, reproduction is over. Yani the liver cannot regenerate anymore. That's where the liver cirrhosis happens. So, unfortunately, as of now, there are no effective medicines uh, to bring back or put back the liver to normal. So, the only way to clear this disease is to change the liver, that is, liver transplantation. Like we select the blood group of the patient, we check the blood group of the patient, and same blood group donor, either from the family or from a brain dead patient whose family is donating the organs voluntarily, like heart, like lungs can be donated, like eyes can be donated, kidneys can be donated. Similarly, liver can also be donated to the same blood group person. So unless we do this liver transplantation, the liver cirrhosis cannot be cured. So liver cirrhosis, the only cure option is liver transplantation. So once we do that, patients again have to be under follow-up, but they have a new liver, normal liver. So their jaundice comes down, their water accumulation comes down, their protein generation improves, their bleeding problems come down, their risk of infections come down, their risk of kidney failure come down. So patients have to take immune suppressants, immune modulating drugs, so that the new liver gets accepted into the body and patients are kept under follow. The other major thing is about diet in liver cirrhosis. Patients are encouraged to take a good amount of protein-based diet and frequent meals. And if patient is diabetic, diabetic diet. If patient is having water accumulation, we do ask them to reduce the salt intake. And if patient is bloated up, lot of water accumulation, we ask them to restrict the fluids also up to 1 liter to 1.2 liters. So that's how we manage them. And once they get at least some confidence, they do well. And some people, the water comes down, the jaundice comes down. So there is little bit of liver reserve still, which can be managed. So that's the indication. So this is all about cirrhosis. So hope you understood everything about cirrhosis. Consult your nearest doctor. You can come back and meet us. You can ask some questions if you have about liver cirrhosis, about liver transplantation, and we are happy to serve you and assist you. So please take good care about yourself. Be safe. Uh, Follow the vaccination protocol for COVID. Uh, Use masks, physical distancing, and hand sanitization. Thank you. Hello. 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 Any questions? Hello. And I'm going to response to our questions. And meeting, huh? Hmm? Hello.